Hi everybody, this is Ben Sturbo with Dr. Jay Hartley at Hartley Chiropractic and Scoliosis Center. So today I'd like to talk a little bit about the importance of a cervical curve. So Dr. Jay, what exactly is a cervical curve?
Well, when you look at the side of the neck, if we were taking an x-ray like this, you should have a forward curve in your neck. So when a woman's pregnant and you got the fetus in there, you're in a fetal curve. So you just have like one curve like this. And that curve helps to protect the mother and the baby. If the mother were to fall, it gives protection and allows flexibility to keep pressure off the spinal cord. When the baby's born, you still want to retain that fetal curve, and that's what's called the primary curve. Then your body starts to develop secondary curves. When a baby's 3 to 6 months old, when they're laying on their stomach, they start to lift the head up. It's an innate reflex, and that's when you develop your cervical curve. That cervical curve gives your body flexibility and strength. So it's the forward lordosis, if you were to look at the neck from the side view, and everybody should have that, and it gives your body strength and flexibility.
So why exactly is this cervical curve so important? Is it just to giving that stability to the body later on?
When you have these proper curves, so forward neck curve, backward thoracic curve, forward lumbar curve, and straight from the front, your body works like a spring, so it's protecting everything, okay? If you lose those curves, you're more likely to have pressure on your spinal cord and your nerves. And the developer of Scoli Brace actually published a study that showed that people, the more your head's forward with a loss of the cervical curve, the more likely you are to have headaches and neck pain. And the mechanism is that pressure on the spinal cord and nerves that it's created from that.
And so how are the curves lost exactly, and what happens when they are?
Well, like we already talked about, at 3 to 6 months, you're supposed to have that tummy time, and the kid should automatically have that reflex. And if you just lay a 3 or 4 month old baby on their stomach, you'll see they'll automatically start to do that. And that's when you develop that cervical lordosis. So one mechanism is the baby doesn't get enough tummy time. They may already have some misalignments in their neck or ligament damage from birth trauma, or for some other reason, they just don't go through that phase. If they don't go through that phase, then they never have a cervical curve. So they're going to have problems. Fall on the head as a kid, sports injuries. We know that there were some studies done looking at different athletes, and when you looked at basketball players, they had a good curve in the neck. When you looked at football players, they had a lost curve in the neck or military neck. When you look at wrestlers, right, they're getting their head held like this all the time, they had a cervical kyphosis. Whiplash is another common mechanism of that. So when your head goes through whiplash and it comes back to a resting state, the x-ray will show that you have a reverse cervical curve. There's also bad habits. So sleeping with a bunch of pillows under your head, looking down at your phone, looking down at your computer, all those things can cause you to lose that cervical lordosis.
Okay. And what are the effects that we can experience? Somebody who's lost that cervical curve, is there any negative effect to it, pain or anything?
And before we started our talk today, I was looking through some of the literature, and it is amazing the amount of symptoms in mainstream literature that can be attributed to this lost curve. So you can have headaches, you can have visual problems, hearing problems, vestibular dizziness, you can have TMJ problems, neck problems, shoulder problems. Now, when you look at scoliosis, when your head goes forward and you lose the curve in the neck and gravity comes down, your spine will be more likely to buckle from the front. So the neck starts to affect other things. It can contribute more to lower back pain, because if you have pressure in your cervical spinal cord and you have a disc bulge in your lower back, it's more likely to cause you problems. So it really can be far-reaching, the effects of a lost cervical curve. And they've done studies on your energy level. So the further your head's forward with the loss curve, the less energy, the more energy your body's going to consume, so you have less energy to do the things that you want to do.
So how would somebody go, how would somebody come in and maybe determine if they have a loss of the cervical curve? Is there anything they can do to measure it?
Yeah, so if you just look at somebody's posture, you're really looking at the head position. Forward head, maybe they're kind of like this a little bit. But the only way really to measure the cervical curve is with an x-ray.
Okay. Is there anything they can do in terms of treatment to fix this?
So we specialize in correction of the cervical curve, and we do it through exercise, adjustment, and traction. And we find that it is very effective, one, at reducing the person's symptoms, two, improving the cervical curve so the symptoms don't come back, and then we teach the patient postural habits, how to set up their computer screen, their TV, how to read, use their cell phone, so that the problem doesn't come back, and then they keep doing home exercise and traction to maintain the correction.
Okay. Thank you very much, everybody, for watching. This was Ben Sturble with Dr. Jay Hartley at Hartley Chiropractic and Scoliosis Center. Please subscribe to our YouTube channel, and thank you very much.
Thanks, Ben.